Welcome to today's webinar on facts, faith, and health equity, justice in our community. My name is Jim Stuckey, and I am Chief Deputy General Counsel with Dominion Energy. Dominion Energy is pleased to sponsor this program today in conjunction with the VCU Massey Cancer Center and the law firm of Hunton, Kurth on this topic of vital importance to our community. Nearly 7.5 million customers in 18 states energize their homes and businesses with electricity or natural gas from Dominion Energy. At Dominion Energy, we are committed to diversity, inclusion, and social justice. Just this year, we launched a $35 million initiative to fund projects at 11 historically Black colleges and universities across our service areas, and $5 million through the Dominion Energy Charitable Foundation to support social justice and community rebuilding efforts. In 2019, the foundation provided $48 million for various community causes, which included grants that support increased food security, housing, and access to basic health care. I am honored to introduce our panelists today. They are as follows. First, we have Pastor Todd Gray. Pastor Gray is a fourth-generation minister at Fifth Street Baptist Church. He has created a community focused on celebratory worship and mentoring programs with local schools. Pastor Gray has helped champion Massey Cancer Center's Facts and Faith weekly calls to educate and empower the African American faith community during the COVID-19 crisis. Welcome, Pastor Gray. We also have with us today Delegate Delores McQuinn. Delegate McQuinn has represented the 70th District in the Virginia House of Delegates since 2009. She currently serves as Speaker for the Black Caucus. Delegate McQuinn is both a cancer and COVID-19 survivor who is known across the Commonwealth for the active role she plays in the community. We also have Dr. Vanessa Sheppard with us. Dr. Sheppard is the Associate Director for Disparities Research and the co-leader of the Cancer Prevention and Control Program at Massey Cancer Center. Dr. Sheppard leads Massey's efforts to advance high-priority disparities in minority health research and education across its various research programs and themes. We also have Dr. Robert Nguyen as a panelist. Dr. Winn was named Director of Massey Cancer Center in December of 2019. Dr. Winn is a practicing pulmonologist. He is a principal investigator on several community-based projects funded by the National Institutes of Health and the National Cancer Institute. He has received national and international acclaim for his efforts to empower underserved patient populations, improve healthcare delivery, and ensure equal access to cancer care. Welcome to all of our panelists. We also have with us Rudene Haynes. Rudene is a partner at Hunton Kurth and a newly appointed member of Massey's advisory board, and she's going to serve as today's panel moderator. She is a leader in the firm's Servicer Advanced Financing practice and has historically represented Ginnie Mae in its multi-class and mortgage-backed securities programs. Rudene is exceptionally committed to increasing diversity in the legal profession and is active in bar, civic, and community initiatives that advance equity in our society. So with that, welcome again, and Rudene, take it away.
Thank you so much, Jim, for your warm introduction. And also thank you to Dominion for your sponsorship of today's program and your bold commitment to addressing issues of racial inequity in many sectors of our society. Speaking of folks with bold commitment, I really want to thank my law firm, Hunton Kurth, in supporting the vision for today's program, Facts, Faith, and Health Equity, Justice in Our Community. So as a general housekeeping matter, although I have what I think to be a pretty fulsome list of questions for our panelists, if you and our audience have any questions that you'd like to share, please feel free to use the Q&A feature on your screen. I will do my best to address your questions, time permitting. I don't know about you, but I am about to spontaneously combust with excitement to dialogue with this extraordinary group of individuals today. You are heroes, and I don't use that term lightly. I call you heroes because each of you in your respective spaces and spheres have fought tirelessly to make right the wrongs in our community and to seek equity and justice for everyone, in particular, the underrepresented and the most vulnerable among us. Today, with your help, we are hoping to be laser focused on the issues and challenges of health disparities and to talk candidly about what we can do to ultimately achieve health equity in our communities. I think it's best for everyone if we just start with the basics. Dr. Winn, how do we define health disparities?
Yeah, I think the easiest way to keep it practical is when there are two groups and one group is getting better benefits than the other. One quick example of that is in lung cancer. African-American men are dying at 2 to 3 times the rate from lung cancer than their white colleagues. That, by definition, is a disparity. But let me point out that in addition to racial and ethnic disparities, there's also disparities within class. And so we can even go to places like Beattyville, Kentucky, and I can show you that where there are people without jobs and from a poorer background, their life expectancy in some cases is 20 years shorter than people in the same area with good paying jobs, et cetera. So disparities are exactly that, when there's a difference that shouldn't be there, but exists between two groups or more.
So I'm glad you talked about the different types of disparities that could exist. I mean, what would you say are the root causes of that? Dr. Sheppard, you want to add to that?
Sure. I think when we think about the root causes, it's very complex and it isn't just one factor. Specifically, when we think about racial and ethnic disparities, there's a tendency to think, well, it's because a person's African American. That's the reason why the cancer rates are higher, if we use breast cancer as an example for mortality. But we have to consider the social context and structural factors and social determinants that we know impact a person's ability to participate in preventive behaviors. For example, if you tell someone to walk, exercise is good for you, but they don't feel safe walking in their community. So these are those sort of social factors that impact health. And when we think also just about breast cancer, at one point, if you think back in the 50s and the 40s, white women and Black women had similar mortality rates. We didn't really see the disparities emerge until technology became better, until we got better at screening, until treatments became more refined. And so what we consider then is healthcare is an important part of that. And why would disparities widen as we get better with technology? And so we have to be very careful to recognize, if we focus on racial ethnic disparities as an example, that it's not because the race of the person. It really is that social context is what is happening to that individual as a result of their race.
I think it was very interesting, the statistic that you shared about historical rates of breast cancer between white women and Black women. Because, I don't think a lot of people knew that at one point in time that the rates were comparable. But let's talk a minute about this idea of why should members of groups not experiencing health disparities care about the groups that are experiencing health disparities? Another way to say this is, why is their problem my problem?
Well, I can start. I think I'd love to hear for others. I think there are many reasons. One, we can't pretend to be a moral society and say that we have the best healthcare in the world or the leading science, and then we have populations within the same city that have differences in life expectancy. When we care for, I guess, the least of these as a principle, if you would, then healthcare and access is better for all. So I'll stop there and let others sort of jump in.
Well, and that's what I was going to highlight first, is that we have a moral responsibility to take care of one another. Me coming from the faith community, that's one of our primary goals in terms of treating other folk the way that we would want to be treated. But I think the other thing is that we lose a lot of human capital when we're not concerned about each other, which which actually diminishes our community and our country at large. Those two things being said, I'll let somebody else jump in.
But I think we're also all interconnected and interrelated. And with the mentality, if we would do that, that a more healthy society would create the improvement of quality of life for everyone. And I think it's important that we also look at the medical reduction cost. If we are providing quality health care and trying to close the gap in terms of the disparities. So I think there are multiple issues that if we look at it, that there are ways that we could, again, advance everyone, but also prove that, well, not necessarily prove, but show that we are interconnected and we care about one another, as Dr. Graves said, and it's a moral responsibility that we have.
And I'll add real quickly that what COVID has shown us is that you can't run. The truth of the matter is, if the poorest among you and the service workers among you are sick, guess you gonna get sick too. And so we know that there was a group of people, and I'm just gonna get right up concrete right away. Some bunch of people who had a whole bunch of money ran away to something called Bald Head, South Carolina. They literally sort of said, I'm going to leave all these areas of high infectivity rate and I'm going to go to Bald Head, South Carolina because it's an exclusive place. Turns out they had the highest rates of some of the of COVID infection. And they started scratching their head. How is this possible? I was like, the people who cook your food, people doing your lawn, they have to come to your house. So you know what? This is the first time that if people don't get it through COVID, the same thing can be translated to cancer. Now, if a segment of our population is bad for all of us. So going back to what Pastor Gray said and Delegate McQuinn and Dr. Sheppard, the reality is it's moral, but it's even practical. That the reality is that if we don't take care of, then this is where you get the overall expenses. This is the craziest thing I've ever heard in my life, that you think you can run away from any of us. You can't go unless there's something that takes them to Mars. If you on this planet, particularly now, we all in the same boat.
It's so funny. So many times during this coronavirus crisis, we've talked about how we're all in this together. We're really all in this together, right? Yes. For all the reasons that you've said. So with that as background, that, their problem is our problem. Everybody's problems are our problems, right? Let's talk about specifically about the health disparities of Black women and men. Do you feel that this group, and I'm addressing this one first to Dr. Sheppard, do you think that this group of people have a higher incidence than others of certain health ailments? We've talked about breast cancer rates, but are there other ailments that sort of really affect this group of people?
So, unfortunately, yes. And African Americans, as the oldest of the non-Indigenous racial group in the country, suffers from higher chronic diseases, diabetes, hypertension, cancer, and so this is why, although we're a cancer center focused, we recognize when you're dealing with the whole person that many of the underlying sort of causes that we were talking about earlier relate to these chronic diseases. And so working in partnership, particularly with our community and addressing issues and how do we work together in areas where there are no grocery stores, but yet we want people to eat healthy foods. And so I think under the leadership with Dr. Winn, as we're really thinking about working in partnership with the community, is how do we bring what we think are our sort of best services, our best knowledge to the community, and then how do we bring in and hear the voice from the community? Because these disparities, I think people have almost become immune to sort of hearing them. It's like, yeah, we expect that. But I think we have to push to understand and begin to tackle the reasons why that African Americans in particular suffer from, overall higher mortality, that there are differences in life expectancy within our state of Virginia, and that we can't accept this as the standard or the norm, because there are things that we can do about them.
So since Dr. Winn decided to, keep it real, let me ask you this question. I mean, you hear all these statistics about, health disparities, about poverty, all these things, and you'll see sort of Black folks or people of color aren't faring well. Sometimes there's a natural inclination to try to say that there's something wrong with these groups of people.
Oh,
What
yeah.
would be your response to that?
Oh, yeah. You know what's funny about that? I'm going to say, it ain't me. And here's what I'm going to start to say. 1619, there was something that actually originally caused a disparities. Even when we thought after the Civil War, things were going to get better, Reconstruction, you had militias and things that undermine that.
Mm-hmm.
So then we were in the 1960s fighting for rights that they even had in 1865. The reality is in the 1930s, a really good thing happened under the FDR movement, right? Everybody should have a house. He believed whether you're black, white, but what happened? The Fair Housing Act or whatever actually happened at that point, which led to redlining. 90 plus years later, we are still suffering the consequences of that redlining. Right. Poor schools, poor housing. In fact, someone said to me, what about this disparities? I go, quit talking about it, because W.E.B. Du Bois wrote about it in 1899, described issues in the Philadelphia, if you want to look it up, Philadelphia papers, what he described: unfair housing, unfair policing, issues around education, issues. I mean, so come on, if you set the structure up so that someone is disadvantaged already, then it is no wonder why those people will have actually increased risk of diabetes, hypertension, and all that. And in fact, what we've got is this trickeration that we at some point started internalizing and thinking something wrong with us. We know that the zip code and neighborhood of association that you live in has much more of a prediction of how well you're gonna do in life than your DNA.
Yes.
And yet we keep still internalizing, well, there's something wrong with African Americans. Honestly, the DNA portion, I'm not saying that there's zero, because Pastor Gray and I have had this conversation. I'm not saying that it's zero, and there are definitely some genetic issues, but a lot of this stuff just comes down to basic blocking and tackling, that the social structures are disadvantaged for one group as opposed to another.
Are you talking about systemic racism, structural racism, institutional racism? Because that's how we got here. And that is the bottom line. And you're absolutely right. It's been 401 years from slavery to Black Code, from Black Code to Jim Crow to mass resistance. And you incorporate all of that into what is going on, what has happened, whether it's economics, education, health-wise. You can just, there's a beeline straight, going back to those various aspects of what African Americans have had to deal with. And that's why, this time when I talked to you guys earlier, I was talking about, I believe something's good is going to come out where we are now, because finally, I believe that there is and will be the dismantling of some of these systems that have been barriers to us advancing and moving forward. And even when some have been able to do so economically, education-wise, or even health-wise, there still is the massive of African Americans who have left behind. And we must not lose this moment. We must not lose it. We must take the mantle and make certain that we run with this to begin, I guess, to finally dismantle some of these systems.
Delegate McQuinn, you got me all fired up here, and I need to stay on my script. I couldn't agree more with what you said. So we've talked a bit about what health disparities are. We know that they exist for all the structural, historical reasons that you've mentioned, but what can we be done actually to prevent health disparities? And first I'm gonna talk to Dr. Gray. Like, what do you think is the role of the faith community in helping to prevent health disparities?
Well, historically, when we couldn't achieve certain things in society, we created ways within ourselves to minister to folk. I think that it's imperative that the church looks as health ministry is one of the major movements in the church, that they develop health guilds and ministries like that, and highlight them so the folk do understand that it's more than you getting your shot on Sunday. I want you to be healthy on Monday. But it's also good for us to collaborate with those institutions that are providing health in non-traditional ways. What we did years ago is we established our own health clinic in the church. We collaborated with Bon Secours and with VCU, and they supplied the staffing for that. And we maintained that until we had to tear down our building and build another building. But also now the Capital Area Health Network, we're still in partnership with them. And we try to use whatever venues that we have in reaching the community to make them a part of it. So we just did a mini community festival 3 weeks ago, and they're one of our major partners. And so they did on-site testing, and I even got my test done through them and had it put on video and had it put in social media, because one of the other things that we have to do, we have to model what we're preaching. Mm-hmm. Folks need to see in us that we have a definite concern. One of the things that was mentioned post this conference is self-disclosure. And a lot of folk do not feel as if they're comfortable sharing their issues with others. And not to be accused of what we call ecclesiastical nudism, but I let folk know what I'm going through. And it's not like I get up every Sunday, but whatever health challenges I face, I let them know. And I let them know that I'm dealing with it and how I'm dealing with it, because I think that's of utmost importance. The final thing I would share is we have a number of forums that deal with various health issues, controlling diabetes, dealing with prostate cancer, especially for men, and breast cancer awareness, etc. What I appreciate about those forums is that we not only have health professionals come in and share, we have individuals share their own story. And by sharing their own story, they make it more possible and palatable for folk to go out and deal with those kind of issues. I said finally, but preachers always have more than one fight. But the other thing I would share, what disturbs me now, is that we have more folk that are waiting longer, and Dr. Winn and I have talked about this, that are waiting longer to go see doctors now, so that we're not dealing with preventative medicine, we're dealing with corrective medicine, because by the time that we go to doctors, and it's made more, excuse me, it has been made more real now during this pandemic, that folk don't want to go to doctors unless they have to go to doctors. And I was reading somewhere where from the medical perspective that we are going to have a significant increase in all types of cancers, etc., because of this pandemic and this kind of fear. So,
So Pastor Gray, you spoke a lot about how collaboration and partnering with other agents in the community is really important to helping, prevent health disparities. You're working with Bon Secours, you're working with the Capital Area Food Network, working with Dr. Winn and the Massey Cancer Center. So I think Delegate McQuinn knows a lot about collaboration. So I'd like to hear her thoughts about what's the role of government in helping to prevent these health disparities.
I certainly think that government could be more instrumental in informing the public, especially communities that are find themselves in the situation that African Americans and people of color find themselves in, to make certain that information knowledge is power. What can we do? How do we invest and the resources in these various communities to make certain that you're getting information to, in terms of not just the diseases, but how do you control those? How do you prevent it? What can you do to just make certain that those numbers, the percentage, are lowered? And then I just think that we have to get in, and Dr. Gray spoke a little to that, alluded to that. How do we get to the point that we create these safe spaces to have these conversations? Right. We have got to have a conversation. I, as a breast cancer survivor, and I am actually 27 years survivor of breast cancer. But I remember when I was diagnosed, and there was a woman in my church I have known all my life. And only then did I find out that she was a survivor of breast cancer. Well, you know what? we need each other in this scenario. And so it would have been nice to have someone to go to once I got that news, to have a conversation about how did you survive? Because what they did, they sent me to a support group at St. Mary's Hospital. And Dr. Gray, I saw these group of white women with 2 3-ton carat diamonds on their hands. And I saw, women who were, 75, 80 years old. And I'm in this group, one African-American person in this group with this support group. And I only, while they're learning and they're understanding, they're supporting each other, I'm standing there and say, what am I doing here? Because we had absolutely nothing in common. And so I just think that we have got to figure out, how do you create these safe spaces? And I think that a government certainly can be instrumental in helping to make certain that we are channeling resources into these various communities and supporting the MCV, the Massey Cancer Centers, who are going to do research, who are going to do studies, and who are going to make sure that that information get out publicly.
Could I actually add one thing to that and what Pastor Gray actually sort of said? And one of the things about disclosure is that in African-American communities, and it can go for all communities, family secrets kill.
Yes.
And so this concept of if you had breast cancer, prostate cancer, don't nobody know it, that is actually somewhat harmful because we know some of these things could be genetic. So if I were able to share, and my family were able to share their history, Aunt so-and-so had breast cancer, Uncle so-and-so had prostate cancer, it might help me better understand that I might need to get checked out faster. But within our communities, and it's probably just not unique to African-American communities, but that's the one I know the best. Most of the time somebody says they got sick, we don't know what they died from. It's important that we tell, like when we tell our history, families, we should tell our history because the history you tell might save someone else's life in your family. And I think we have to, again, with that transparency, and I think from a government sort of perspective and from the ecumenical, I have to say that on this call, I couldn't, Virginia has gold right now with Representative McQuinn and with Pastor Gray. In fact, I really believe that I have been blessed being here and getting to know these folks, because the reality is you ain't getting nobody who's going to fight harder and tell you the way it is. And I know that, a week ago, I experienced, Pastor Gray was just like, we had a meeting and I know I could feel him coming through the telephone. Like, so saying, come on, y'all, tell the truth. And so the reality is part of our movement ahead is actually having folks just like them who are going to keep the systems also honest. And so I just had to get that up off my chest.
And even from a spiritual perspective, that, our faith is all about sharing and encouraging and inspiring someone else. When I was first diagnosed, all I could think of was my death sentence. That's it. Initially, I'm like, breast cancer, the big C, the big D comes behind that. And so when you have someone who survived it, then you know what? You need that individual to help encourage you, to motivate you, to help you fight doing whatever that experience is as well.
And so, I just want to underscore so much Delegate McQuinn, because the churches, as we educate and to make it okay and people see survivors and know it's not a death sentence, then when that person goes to their family can have the right information, because we have seen situations, and I know because I've lost a friend to breast cancer when she was 32, where the church that she was going to said, we don't believe in chemotherapy. We don't believe in treatment. And so when we talk about today, faith and facts, right? So we know with faith, there's no fear. And so I think that for sometimes in the community, there's this thin line between faith and fear. And it's the fear that stops us from moving forward with the treatment, but we guise it as it's disguised as faith. And so I think the work of Pastor Gray is so important, that as we're educating and we can bring this information to communities, because, for my friend, which is why I fight and bring this up, it was too late. By the time she decided to get treatment for her breast cancer, it had spread to her brain. and 2 sons she left behind. And so I think it's very important that we educate the patient and have these survivor groups, and their family members have to know so they can be that support.
And Delegate McQuinn, I think you really touched upon something about how, you know, with our government, we really need to have more investment in sort of research and funding of these health disparities, right?
Yes.
So we keep talking about health disparities research and wanting to do more, but what exactly is health disparities research? Dr. Sheppard, Dr. Winn, can you fill us in there?
I'll let Dr. Winn go first.
Well, one of the things in health disparities research is really, for the first time, it's taking on some substance. I think when we were doing this work, started this work 20 years ago, 25 years ago, someone told me, "Why are you throwing your career away? You sound like a bright young man to me," was the line was, "You sound like a bright young man to me who could go places. So why are you wasting your time thinking about health disparities research?" It's interesting that 25 years later, you know, it's clear that looking at communities and populations and looking at not just how we discover things, but how those discoveries can actually be implemented in and of itself as a science. And so I think that this health disparities science goes all the way from looking at the structures and how they impact chronic disease, all the way to how one's social stresses in the context of, you know, literally social stresses, how those social stresses can actually impact your genetics that you're born with. So you may be born with the best DNA possible, but those social stresses and all these other things can have a way of shutting down those good, you know, protective genes you have and putting you at risk. It's finally starting to understand that as a real science has really been able to accelerate the field now of health disparities. And I'm gonna get technical. Health disparities research is when you're looking at one group and comparing them to another. Minority research is when you're like, I ain't comparing none. We know what's up in the African American community. That's what we're gonna study. I'm just keeping it clean. But that's kind of where we are. I don't know, Dr. Sheppard, if you had anything to add to that.
No, I think that's right on point. And I
One
think
of the premier health disparities research is right there.
Wow.
Dr. Sheppard, right there.
Well, you know, what I think is great is that you really see it from the bench to the community, and you need them all, right? You need African Americans to participate in clinical trials. A lot of times it's not because we just don't want to. Research has shown that when asked, when trials are explained, that Black individuals will participate in clinical trials. And so I think we have the opportunity to push the envelope to look at a trial and say, well, why don't you have a recruitment strategy? Why don't you to include African Americans? Why don't you partner with some community organizations and then bring back the information to that community? Because we do need that trial participation, and then recognizing that, you know, with some of the work that we do, you may need to look at your eligibility criteria. There may be things. And so I think this moment is really great because we can press hard to really begin to make a difference in this regard with health disparities research.
Well, you know, I think we've tiptoed around this next topic a bit, but I think we need to just kind of put it on full blast. And this is this idea about there being skepticism in the Black community with respect to medical research. You know, think about
Pastor Gray.
You think?
Go to Pastor Gray.
So yes, Pastor Gray, would you like to talk about the skepticism and what could be done to help Black communities overcome that skepticism?
Well, historically, we have been mistreated at the hands of medical science. And so we have to have that consideration in play. I was surprised recently. I had a discussion with a number of pastors who said that they did not believe in getting vaccines. And I'm not talking about the COVID vaccine. I'm talking about vaccines, period. They prefer homemade remedies rather than going to doctors, which really surprised me. I mean, it really surprised me. Somebody even brought me by some elderberry syrup to make sure that that I had that as a replacement for doing something medically, which I don't subscribe to at all. But in terms of how we get beyond that, having more Robert Nguyen's and Vanessa Sheppards that collaborate with churches and folks seeing them and learning to trust them is one of the ways in which we overcome that. I am so delighted by the work that Dr. Winn has done in terms of our Faith and Facts call every Friday. We get the best medical advice. We get the best statistics. and it helps us formulate how we're going to minister to our folk. He was quite early in sharing with us whether or not we were even safe to reopen churches. And so we had a number of churches that made their decision based upon that kind of information. And developing those kind of relationships, I think, is key for how the church interacts with the medical community.
Well said, well said. We talked about how sort of in the Black community, people of color community, sort of generally, you know, when folks have ailments, they sort of, you know, keep it to themselves. And we all were impacted by the untimely death of Chadwick Boseman at the age of 43. This guy, he breathed life into iconic historical African-American figures. And then he gave us our Black superhero, T'Challa. But he secretly struggled with his colorectal cancer for 4 years. I'm saying all this to say, you know, I think it's really important what Delegate McQuinn said before about how we need to feel safe and feel comfortable talking about, you know, whatever might be, you know, troubling us medically in an effort to help those around us. But Delegate McQuinn, you are a trailblazer on so many fronts. You've been very vocal about your experiences with cancer and COVID. I mean, why do you feel compelled to share your story? Although you shared a little bit of that, but I also want to know what reaction or feedback that you've gotten from others by your being so open about your own personal situation.
You know, I wanted to, I guess I share it because I want to put a face with the malady, you know, of the time. I wanted people to understand that, you know, cancer does not always mean a death sentence. Being diagnosed, there are, you know, with the medical advances, and I still talk about it. I have, matter of fact, been very much involved and engaged in a national organization to make sure that we are sharing it with the Black community, the particular Black women. But I want, you know, I wanted people to understand that there is a face, a one that you see, you know, I'm a public face most of the time. Either I'm somewhere smiling or fighting one way or the other. And so, but I wanted them to see a face of someone that they are familiar with at a distance, but have had to engage in struggles. And in those struggles, I was able to survive. So I am in many ways a face of a survivor of two, in many ways, deadly diseases. And now I am, and I think I said to Dr. Winn, you know, the COVID-19, people are calling me all over the place, wanting me to speak. And I'm like, I hope that they don't think I'm wearing this as a badge of honor. But I am thankful to God that I was able, and my family was able to get through this. And so I'm hoping that it can be encouraging. I'm hoping again that it can inspire people to, even in the midst of a struggle or having bad news, fight. I mean, still fight and persevere, you know, until you cannot do it anymore. And in terms of the response, you know, it's funny. One of my colleagues, when I first went to a meeting that we had, I had two colleagues, and when they saw me coming, they went in another direction. Now I'm over the disease, okay, long ago, but they went in a different direction. And one of them made a statement, I just left it alone. But I think that I've talked to some other individuals who've had COVID-19 who said that they felt like they're treated as I did at that point, as a leopard. I mean, that here you are still wearing a disease that is gone. And they had probably had a better chance of being affected by it at that time than I did. But the overall response had been so encouraging. And I mean, people from all over, when they found out, said, thank you for coming out and saying that your family survived it. And so overall, it has been just, I've been overwhelmed with the support across the country. but my colleagues and Virginians have been just overwhelmingly supporting me and just thanking me for coming out.
Can I add two things? That's a testament to why we need better science taught in high school. Because, you know, once you get an infection, you got antibodies. So anyway, leave that alone. But I am going to say that I think this is where, for me, and I have nothing but utter respect for Brother Chadwick Boseman. But as a young person, it would have been very useful to hear his struggle while he was making the movie than after the fact. In fact, I think this is, again, the secrets we carry. And I know and understand the secrets we carry, but how many more people could have been affected by understanding that the Black Panther is making that movie while he was getting treatment? It might have encouraged other people to say, well, if he can do it and look this good and make these thoughts at Howard, then I can't too. And so again, just getting back to the point that we live in an age of, it's interesting, we live in an age of sharing. So we'll share what tomatoes you just bought at the grocery store. We'll share that I'm walking down the street to get my car. But the crazy thing is the things that matter for sharing, we tend to keep those secret. And one of those things is around health. And again, I think if there's something that I can do, and I know I'm not the typical cancer center director because I'm supposed to talk about drug discovery 24/7. I know we got a new miracle drug coming on, but the prevention part matters. And part of prevention is actually being more transparent about your history and your family history around illness.
So Pastor Gray, you know I'm going to pivot to you, right? Because you have a congregation that you present to virtually or in person someday soon. And how do you encourage your church folk to be more open in talking about their health and wellness? I know people love you as a pastor, but some people, they don't love you enough to tell you if they're struggling with cancer or COVID or any number of ailments. So what do you say?
Well, in the main, of course, you know, that's a relationship that I've developed over 25 years. So there is a degree of trust, not only in confiding in me, but the information that I provide and the counsel that I provide. But one of the big things, and this is one of the reasons why I'm so appreciative of Delegate McQuinn is because of her transparency. Now, some years ago, I had to have hip surgery. And after I got my hip replaced, there was a gentleman that was in our church that came to me and said, I've had that problem for years. I just didn't think that I would be any better by going through it. I didn't want to go through the pain, et cetera, but that I saw you recover. I'm going ahead and have the surgery. So that's a way of breaking down barriers and making what we're trying to do health-wise available and practical for folk. When they see you go through something and see that there is hope on the other side, Sister McQuinn, when they see that, it makes them more likely to avail themselves of those kind of services.
Well,
and it also makes it takes a stigma away from it. Now, one of the things that we have not talked about is mental health, because we always look at mental health as something that not only do we keep to ourselves, but we don't even want to acknowledge that we've got a problem. And especially during times of pandemic, everybody needs a mental checkup some kind of way. Because it's crazy out there. And you know, I have thought.
Say it's crazy out there. It's crazy in here, sir. Crazy in here.
It's just crazy.
I understand.
It's just crazy.
But what I've shared with my folk that I see a therapist. I couldn't do what I do without having some professional consultation, because you can't talk to everybody. But you have to acknowledge those kind of things. I was teaching in the Bible study and I was sharing that. And one of the health professionals that was in the Bible study came to me and said, look, I talk about this 24/7, but you say it one time and folk will respond to it. So I just think that those are some of the ways in which we tear down these kind of barriers or stigmas attached to getting medical and mental health.
Understood. And I'm glad you brought up mental health because there is a
Yes.
stigma associated with it, especially in the Black community. So yeah,
And
I
we
see a
had needed
therapist
it.
too. It's important.
We needed it before COVID-19.
Right. Right.
You're exactly
Going
right.
through the, yes, the post-traumatic
You're exactly right.
stress disorder. Yes, yes.
All of this, right? So let's talk about this because I think COVID has unveiled a lot of things in our society, right? So right now we have this like racial awakening, racial reckoning, whatever you want to call it. But people are realizing that we need to, fight for racial equality and racial equity. And I think necessarily what's part of that is this need for health equity. So Dr. Sheppard, I mean, what are the signs and symptoms that we've actually achieved some measure of health equity?
Wow. I could have had the other question. One of the things, I think some signs will be, and I'll speak personally, I have twin boys that are 14. I'm already stressed about when they start to drive. Right. We've been talking with them since they were little about driving. And now, of course, as they're getting ready to go out, they're beautiful young men to me, but that's not how the world sees them. So even if I'm not talking about cancer, I know there'll be equity when I don't have to worry and prepare them about how to respond when they're pulled over, not if. Right. And then thinking about it, then I get angry. I think we'll know that there are signs of equity when we drive around our city and drive all the way around it, and you don't see you don't have this huge difference in one place from, beautiful houses that seem well protected, and you go a little further where there's a murder almost every week. And so, because all of that has to do with health. And so I think that there are cues around us to let us know that we're moving towards equity, as we talked about before, in terms of an individual having the opportunity to take care of their health, having the opportunity to purchase healthy food. And, I think we'll also have some signs towards equity when we go to our health provider and we see people that look like us, that are not just cleaning, but we'll see, it won't be an anomaly. Right. And then the people that are coming to talk to you about clinical trials will look like you. They'll speak your language. They'll be from your community. So these are, to me, some of the signs that we've gotten there. Of course, when we talk about a specific study, there have been some studies that are showing where certain interventions do work. Right. There's some interventions that, whether it's a therapeutic intervention that we know extends one's life once you're diagnosed with cancer. There's some things that we know from an access-oriented perspective, that providing insurance, when you're diagnosed. So we have some screening programs, not having to do it in piecemeal. So, I was screened through here, but my insurance doesn't pay for the surgery. So we're not surprised when there's a delay to treatment. So, so I think that there are things that we can do at multiple levels. And, as all of us, around the table and on the call, as we look in our own communities, there's certain things that we can see that we're moving in the right direction.
Thank you. Thank you very much.
And Rudene, I think one of the things that have happened, that's happening as a result of where we are, is now in legislation that is being put in place, demanding certain things. And there have been some pushback on some of them, but I think these are going to bring, some of this legislation will certainly bring about some major changes. And you still have to work on the behavior, but if the legislation is there, then you hold people accountable. And I think that's going to make a big difference as we move forward in terms of equity and equality for all Virginians.
And I'm glad you brought that up, Delegate McQuinn, because accountability is really critical to achieving equity in all sectors. So yes, I'm glad we're seeing more legislation addressing these issues.
And I also think that moving, and I think Pastor Gray talked about it, I think the 1950 models that everybody comes to the big, sort of the motherships to get their care is insane. We need to actually make sure that we are really thinking about different models. So equity, or how to get better equity, is the more we know we move things out closer to people, the more they're likely to access it. So the issue with, having health ministries in churches and working is a brilliant idea. Why? Because what we learned from COVID is that it turns out that you may not have thought or may have thought that churches went away and they weren't anchor institutions like they were in the 1700s, 1800s, 1900s, 1950s. But it turns out that when your school shut down, when the library shut down, and when all these programs shut down, the one thing that kept going, right, were these faith-based, these sort of churches. And so when we think about anchor institutions, we need to think about how we could better leverage those anchor institutions, particularly faith-based and other organizations like that, that could remain and be real partners for us. For example, people are worried about getting kids to work. This is, you know, are they having to work, but what do they do with their kids? There's this wonderful program in Houston where they said, well, listen, your internet is spotty in these neighborhoods. Why not just come to this church and we can organize something? We're gonna have to think about how to better use that. And again, I'll end with just 1.0 Kanye West now. Now don't get me all mixed up now. I'm talking about Kanye when he was 1.0 now. He said something about, you know, frequently we focus on what we're lacking as opposed to what we're packing. And another way of saying that was my grandfather used to say that if you want to keep somebody who's brilliant down, just keep telling them that they're not brilliant. Right? And hopefully you'll be lucky enough that they believe it. So again, as we're starting to think about these things, we also have to be thinking about what things do we have, what assets do we have so that we can build from. For example, for me, it makes me happy to know that there was a disparities gap of 33% between African-American and white with overall cancers. So if you look at all cancers, in 1999, we had a 33% gap. That gap is now down to 14. So it means that we can do it. We just need to do more of it, because once we get in this land of desperation, that we got two things against it. It's on us. It's just that we got bad genes. That ain't true. And the second one, there ain't nothing we can do about it. That ain't true either. We have to really, again, focus on our assets. And I want to, again, make a shout out to Representative McQuinn and others, particularly within the Black Caucus, and Pastor Gray, and that whole Facts Friday, Pastor Nelson, a whole host of folk who recognize that these are our assets within our community.
Yes.
So, Dr. Winn, since you do have the floor, I was going to ask you, why is Massey Cancer Center in front of all these issues? Why are you here? Why is Dr. Sheppard here? We think of your work as being specific to cancer research and that alone, but obviously it's beyond that. So tell me, why are you here? Why are you doing this?
I'm gonna blame my mom and my grandmother. Good. And I'm gonna say that and again, transparency's sake, as the product of a 15-year-old mom, all my life, it has really been this concept that even as we went to Notre Dame and all these other places, that this connectedness to the community, that as I gained more knowledge, this knowledge wasn't good enough for just knowledge for knowledge's sake. I had to do something with it.
Yes. And
do something with it and organize it in communities that I know were negatively impacted by not having access to this stuff. So the why has been driven, and you always sort of say that, I've written a piece once that sort of said, we need to ask more. The reason why we need more diversity within science is because your background is really driving some of the questions that you even ask. And so we think about science as being completely not related to the person and completely unemotional. It's just, actually, to be honest with you, even your Nobel Prize winners are sometimes asking questions that were relevant to them as they grew up, that they wanted to answer. And in fact, wouldn't it be wonderful if we had a diverse group of people who are coming from multiple different areas who can say, this is a question that I know would impact my community, and this is why I'm pursuing. So the why I'm here in part is that, but the other thing is because honestly, Richmond, and right now, this is the place to be. This is ground zero for a lot of reasons. And in fact, the momentum and the energy I think that we are now carrying, I know that I'm in the right place. And to be honest with you, Massey Cancer Center was a NCI designated. Now that don't mean nothing to anybody other than that's just the big gobbledygook, but we're celebrating the 50th anniversary of the National Cancer Act in 1971, the war on cancer, that started the war on cancer. As a result of that war on cancer, you had one of the first federally designated cancer centers in the country here at VCU Massey. But we're able to do with that, with those federal dollars, we're able then to do the research, and I'm able to then take it beyond just the bench and really bring this out in the community. And so the reality is, this is the place to be. And in fact, I'm even more convinced every time I see, I'm telling you, if this wasn't over virtual, I'd be hugging right now, Pastor Greg. I know, be like, you know what I'm saying? With my mask on though, but because you have leaders in this community that I don't know that we recognize the power of movement that we actually have and the opportunity to sort of make a difference. So, I mean, I'm here because again, the truth of the matter is not to get holy-dolly. I've been called to be here.
Yes.
And in fact, I am so glad to be here and among this group and I know we're going to make a difference. In fact, I sort of said, if I had to come back, reincarnation, I would rather be the first, and I had to be a dog on the dog sled team, I'd rather be the first dog, as scary as that is, because he may fall off the cliff. He don't know where he's going. I'd rather be that dog than the dog at the very back of the pack who's looking at the same thing the whole way through. So I'm just saying that we have an opportunity, I think, as people here in Richmond, to do local actions that may have national impact. And at the end of the day, I mean, that would be a life well worth living.
Well, I think everyone can agree that we're blessed to have you and
Yes.
Dr. Sheppard here. So Dr. Sheppard, because Dr. Winn took up like most of the time, but I was—
That's okay. That's all right. That's okay.
I'm going to turn the floor over to you so you can have the last word.
No.
Close this out.
So I am enthusiastic and thankful to be here. And, I moved from Washington, D.C. here because I was impressed with Massey's commitment to the community. And I think we have a unique opportunity because of the people that we serve. I am thankful for some of the work that I've been able to do for AMA's Army of Cancer Warriors. When we talk about social determinants of health, being able to provide transportation to help people get to treatment. So those are some of the things that we're able to do here that I wouldn't be able to do with our outreach team if we didn't have community ambassadors and philanthropy. So I'm thankful for that. I can say that it's not just a job while we're here. We're here because this impacts our community and our families. Every life matters. And so while we talk about numbers and facts and statistics, it's every person that we touch that we want them to survive. And enough people have died unnecessarily from cancer. We are excited that we will be launching a new initiative. And Dr. Winn mentioned the decrease in the mortality differences between Blacks and whites, that it's down to 14%. And that's because of a lot of focused effort. And we want to push it beyond that. In our area, we want there to be no disparities in cancer outcomes between Blacks and whites. And so we're going to be launching the 25 for 25 campaign that's focused on health equity and justice. And this initiative, we're going to be focused on health equity, particularly in the African-American community. And I think that this is going to help Massey as we really want to have leadership for our state. And, it's not just Richmond, but we want to have us on the map to be able to do this and continue this quest. It's going to start October the 1st through the 25th. And use this really as a catalyst for advancement. You're going to receive some information about that. I want to also just give a shout out and thankful of appreciation to Apex Systems. They have generously kicked off this campaign 25 by 25 with a $25,000 commitment. And so I just want to give say thanks to them as our presenting sponsor. And we do have the leadership of Buddy Mahandro from Apex Systems in supporting this initiative. And so without that type of philanthropy, we may be limited to research only, but we know we can't do research without the community outreach and engagement. And so we'll be kicking that off. And I know I feel blessed to be here, and I'm so thankful that Dr. Winn is here. And we're committed to making a difference.
Outstanding. First of all, again, I told you at the beginning of this that I felt like I was going to spontaneously combust because I was so excited about this dialogue, and you all have lived up to it. I really appreciate your candor today. I think we've had a great conversation, and hopefully this is one of many to come. I thought it would only be fitting for us to close this discussion with a quote from the Black Panther, T'Challa, when he said at the end of Black Panther, "We must find a way to look after one another as if we were one single tribe." Again, I'll repeat that. We must find a way to look after one another as if we were one single tribe. Thank you. On behalf of VCU Massey Cancer Center, our presenting sponsors, Hunton, Kurth, and Dominion Energy, our panelists and me, I'd like to thank each and every one of you all who joined us today via Zoom. And we thank you for all that you're doing in your own respective spaces and spheres to achieve health equity in the communities in which you live. I hope you all have a great day.